Hello everyone, I'm Dr. Abhirami, your physiology faculty, and I'm here to discuss an outline of how will you go about preparing for your next exams. I'm sure all of you are aware of the changing pattern. From NEET, we are slowly changing over to next pattern of exams. So the first question that comes to us, when to start the preparation? What is the right time to start preparation for next exams? See, there is no right time fixed because nobody has a clear idea of the proper next pattern of exams. So we don't know whether it's going to be next 1, 2, or 1, 2, and 3. So apart from all those confusions, so we should be clear in something. If you are in your first year of MBBS curriculum, then that is the right time to start your preparation. If you are currently in the second year of MBBS, then that is the right time for you. So in whichever phase of MBBS curriculum you are right now, that is absolutely the right time to start your preparations, because we're not sure about what is going to be the upcoming pattern for the next exams. So until all that is clear, let's not waste time. In whichever part of the phase you are, just start your preparations right now. Everybody has a dream, but only few have a good plan. See, look at that little sperm there with a bouquet in its hand. See, all the sperms are approaching the ovum, but look at that one little sperm there, very smart one. All of them are doing hard work, but only that little sperm with a bouquet in its hand is doing a planned smart work. So what you need to have, what kind of knowledge and clarity you need to have for your next exams is something like this. Not only hard work, but you need to have a smart work and a clear planning strategy. So what is that planning? How many subjects do you have in your MBBS curriculum? Around 19 subjects. So it is humanly not possible for anyone to read all the 19 subjects from first line to the last line. That is impossible. So even for me, it's not possible. So what is that kind of smart work that you can do? If you try to read all the 19 subjects from first page to last page, that is hard work. But that is not important here. Smart work. What is that smart work? High yield topics. If you are able to pick up what are all the high yield topics in every subject and focus more on those high yield topics, then definitely will be on top of the list. Because what all the toppers do, what they say is, ma'am, we were not able to read all the subjects, all the portions completely. So they were able to select what are all the high yield topics in every subject, focus on them first, because later, even if you don't have time when you're close to your exams, you may be leaving some topics without reading. So if you focus on the high yield topics first, even if you're going to leave some topics, they are going to be the unimportant topics. So please focus on high yield topics. Ma'am, how will I know what are the high yield topics? So there's an answer for that. Can you think what do we do from our school days when you want to write any exam? If you don't have time, when you're close to the exams, what do? We take the last 10 years of question papers and you go through all the questions, read only those questions, go write the exam. I'm sure even in your MBBS, first year or second year or third year students, some of us just before the exam, you take the question papers, 10 years of question paper, just try to go through all the questions, you go write the exam, 100% you will get through your exam. So students who have gone through the previous year papers, they are more likely to pass their exams, to get more score in the exams. See, that is because even the NAT board, the National Board of Examinations, who's conducting your exams, so they also focus on high yield topics. Very rarely they ask questions from a very not at all an important, a very rare syndrome or a very rare disease. Very rarely only you get questions like that. So please keep this in mind. Common things are more commonly asked. Don't keep searching for some uncommon topic, unimportant topic, and keep reading that. Very less likely that you'll be getting questions from all those unimportant topics. Important topics are repeatedly asked. Please focus on repeated topics first. If you have time, you can go on for the other topics. So please try to do this. Take last 10 years of NEET exam papers, MCI papers, AIMS papers, or any set papers, and see what are all the topics from which questions have been asked. Then definitely you'll get an idea what are all the important topics, where should I focus more. So that is one of the planning that you can do. So the other thing is, please practice a daily routine. So what is this daily routine? See, like how you get up, you brush your teeth, you take bath, you have your breakfast, lunch and dinner. Keep a daily routine practice of solving MCQs. At least 10 to 15 questions per day, you should definitely solve. You should allot time for at least 10 to 15 questions per day, maybe in the morning or maybe during the lunchtime or just before you go to sleep, like how you go through your Insta, Facebook and WhatsApp chats. So just go through 10 to 15 questions. See how this daily routine practice of solving MCQs will help you is, solving MCQs itself is an art. It's not that easy work, because you should know how to solve a question. An MCQ has a question and 4 options in it. So you should be able to exclude the wrong options and get the right answer. That itself is an art. It comes only by practice. The other thing, you should know whether to answer a question or to leave the question, because you have negative marking in your exams. So if you choose the wrong answer, you will have negative markings. So you should have that kind of knowledge. You should be able to assess, am I going to answer this question or I'm going to leave this question? That also comes by practice only. Suddenly, if you go and appear in your final exams, definitely you can't get that. It won't happen. That magic will not happen. So it comes by daily practice. See, another thing is, by solving everyday questions, you will be able to assess the probability of getting the right answers. So let's say, for example, there are 4 options. If you are able to exclude 2 options, you are damn sure that these 2 are not the answers. You have only 2 options left. So you have to choose between these 2. See, if you assess the probability, there is 50-50% chance, 50% of getting it right, 50% of getting it wrong. So if you have a situation like this, you can definitely go for an answer. You can try to answer this question, because there is more chance that you will get the answer right. But if you have 4 options, you are not able to exclude any of the options. You don't know whether it is A, B, C or D. You don't have any idea about what is the answer. You're not able to exclude any of the options. Then it's definitely not the question for you. Because if you try to answer a question like this, where you are not at all able to exclude any of the options, there's more probability that you will go for the wrong answer. So how will you get this ability to assess the probability, whether it's going to be right or wrong? That also comes by practice only. Every day, if you keep solving MCQs, then definitely you will get into that practice. You will automatically start assessing. Whenever you look at a question, you will have that idea. Will I get it right or will I get it wrong? So that comes by practice only. And the other thing is time management. If you have the practice of solving questions every day, at least 10, 15 or 20 questions every day, you will be able to know how much time you're taking to solve this many questions. So in the final exams also, you will not have problem with time management. You will have an idea how much time to spend on each question. So that also comes by practice only. And final thing is computer-based exams. So all of the exams now are online exams. So no more pencil and shading and all that. So you just have to sit on the computer and it's going to be an online exam. So some of us may not have a good knowledge in usage of these computers. So every day, if you solve exams, solve questions, whether in your mobile, by clicking on the option and by giving this OK or submit the answers, and you wait for the online exam to get finished. So all this comes by practice only. So if you have a laptop or a computer or a mobile, so please practice solving questions online, because computer-based exams are not that very easy when you just go like that and attend the exam. Definitely you should have good hands in operating the machine. So that also comes by practice only. So for all these reasons, I'm telling you, please practice a daily routine, because this is what most of our toppers have given the feedback. We have practiced every day at least 15 or 20 questions, and that have helped us a lot. So that is about practicing questions every day. Wrong answers only challenge. See, this is another strategy. Whenever you solve MCQs, see, every day if you have the habit of solving MCQs, and there are 10 questions you solve every day, out of the 10 questions, 8 questions you are getting right, 2 questions you're getting wrong. So please note down the questions that you're getting wrong, mark the questions that you're getting wrong, and of course your advanced computers and advanced your applications, all that are doing more of this. So you just have to bookmark or something like that. Keep marking the questions that you're getting wrong. Finally, when you do a revision, so you will have to spend more time on the wrong questions. So whichever question you have given it wrong during your daily test, to take time to revise those topics again, because if it comes in the exam, it's more likely that you get it wrong in the exam also. So please have the habit of either bookmarking, or you can just write it down, write the topic from which, suppose there's a question from speech physiology and you're getting it wrong, a question about Broca's area or Wernicke's area, you got it wrong, you just note it down, speech physiology, Broca's, Wernicke's. So that's how when before your exams, when you're trying to revise, you can just go through the topics that you went wrong, so that you'll be more clearer about the wrong topics, the wrong questions that you went wrong. Because wrong answers are the only challenge that makes you differ from the others, whether you're going to be on the list or you're going to be out of the list. So have this habit. Strategies to solve. Usually students ask us, ma'am, what is the strategy to solve questions, solve MCQs? See, there is no fixed strategy to solve MCQs. If you have watched Big Boss, have you watched Big Boss? Yes. So many people are there in the same house. You would have noticed each one will have their own strategy to answer to maybe to do a task or to move step by step in the program. So each one has their own strategy. The same thing in the exam also, MCQs also. There is no fixed strategy for attending MCQs. It depends upon how you have prepared, what content you have prepared, how many topics you have read. So that is what going to decide your strategy in your exam. So you should be able to fix your own strategy. See, that is, some students, they focus more on giving many right answers. Some students, they focus more on not to give wrong answers. They are more worried about the negative marking. Both of them have the equal probability of being on top of the list. So each one has their own strategy. So please don't follow other strategy. You fix your own strategy and go with that. So that also comes by daily practice only. Only if you do a daily practice of MCQs, you will be able to assess your own self, and you, by the time you reach your final exams, you will understand yourself. You will know what is your strategy. So please do that. Look at this question. 2024. I look at the options A, B, C, and D. Oh my God. If you have a question like this, what will you do? What answer will you go for if you have a question like this? Yes, there are questions like this. Not all questions. Very rarely, very few questions like this. And they are the most challenging questions. You should be very careful when you have a question like this, because all 4 answers look like they are the right choice. But only the question paper setter will know what right choice he's having in his mind. So if you have questions like this, where you are not able to come to a right answer, please do not waste time on these questions, because how much ever you think, you're not going to arrive at the right answer, because all of them look like the right answer. So just skip these questions and move on to the questions that you know the right answers. So do them first. Maybe later, if you have time, you can come back to these type of questions and look back. Or what more students do very intelligently, they skip these questions. because all four answers are looking like the right answer. Only the examiner knows what is the answer in his mind. So maybe when you face questions like this, you should think twice before answering these questions. See, this also comes by practice only. Only if you solve questions every day, you will come across questions like this. Only then you will be able to know which question I should attend, which question I should not attend. Another rule that helps us in preparation for next exam, not only next, any type of exam, Hebs rule. Have you heard of Hebs rule in neurophysiology? Yes, Hebs rule is, see, all the content that we learn, all the subjects that you learn, all the faces that you see, all the memories, everything is stored in synapses in the brain. So if you have the ability to strengthen the synapse or weaken the synapse. So that's why if you really, really love somebody, you keep thinking of that person again and again and again. That person's face will automatically get registered in your mind and it will be converted into a long-term memory. You will never ever forget that person. And same thing can happen if you don't like somebody, we easily forget them because we never think about them. Same thing with your subjects also. If you keep on thinking of the subject, if you keep on revising and recalling again and again, automatically your brain will strengthen all the synapses that is holding all the subject. Suppose if you like physiology very much, you have a tendency to listen to the class properly, you take more notes properly, or you solve more questions in physiology. You keep doing this again and again. Physiology will be converted into long-term memory in your brain. There's another subject which you don't like. Automatically, if you don't like a subject, we don't tend to listen in the class properly. You don't take notes properly. You don't revise that again. You're afraid of the subject. So that subject will never get turned into a long-term memory. So this is how Hebs rule. You can strengthen your synapses, which is holding all your subjects. So the rule is read once, revise 3 times. So you keep revising the same thing again and again and again. Even if you don't like the subject, automatically your hippocampus will convert all the short-term memories into long-term memories. That synapses will get strengthened and you will never forget the topics at least till your exams. So that is Hebs rule. Read once, revise 3 times. When it comes to physiology, some students keep asking them, what is the book to read? What is the book of choice? There are so many and many books in physiology. As you can see, few books which are very conceptual based and few books which will directly give you the points. But the book of choice for preparation of next PG exams for physiology is Genong's Review of Medical Physiology, because any question in physiology, this is from Genong only. The right answer, the choice of answer is also from Genong only. So the book, if you ask me, definitely it's Genong's Review of Medical Physiology. So this is going to be a purely workbook based learning where we are training you for next PG exams. So we use the workbooks. So we are not going to allow our students to write and write and write all through the day, because we have prepared these workbooks. For example, physiology workbook. So I have designed it in such a way that there are around 330 pages in physiology workbook. And whatever I'm going to teach you in physiology, all the diagrams, all the tabular columns are all imprinted already in the workbook. So you just have to mark the parts, fill in the tables as we are taking the class. You can just do this. See, this is to reduce your workload of writing so that you can concentrate more on the teaching, more on the subject, what the teacher is saying, rather than spend more of your time and energy writing and writing notes. So most of the content we have given it in the printed form. So this workbook is going to be of immense help for you, not only for physiology, for any subject. So we have prepared these workbooks in such a way that it is going to be useful for you, not only during the classes, even after you finish the class, keep the workbook safe, whatever notes you have taken in the workbook, try to revise from the workbook. This is almost like going to be like a standard textbook for you for a preparation, because we have made an analysis of all the standard textbooks, all the previous year questions, and we have made the work more easier for you, so that you just take notes in the workbook, read that, revise that. That is going to be more than enough for your preparations. See, this workbook has been designed in such a way, it's not only going to help in your next MCQ pattern of exams, but also your university exams. For example, if you're a first year student, you're going to attend the first year university exam. So definitely, if you read from this workbook, you're going to answer all the long questions, short notes, essays, and moreover, I think in the NMC curriculum, you have your MCQ questions also in your theory exam. So all this is going to be incorporated into the workbook. So not only for your next exams, even for your theory exams, for university exams, you can use it as a textbook for reading before your exams. So please keep this book safe, at least till you get your PG seat. Keep adding notes to the workbook. So this is also an art. Have you seen those sticky notes? Many students use the sticky notes. You can use it to stick it on your workbook. Maybe you can just note down the list of, if suppose there's a topic on basal ganglia, you can just write it down. Long note, 2 times it has been asked as a long note. Short note, 3 times it has been asked as a short note. So that whenever you revise just before your exams, you can just fastly go through the important topics. Or even you can write how many MCQs have been asked in the previous year from this topic. Or you can just write a summary if it's a cerebellum. 2-3 pages of cerebellum you have read from the workbook. On the last page, just stick a sticky note and write a summary of the cerebellum. What are all the nucleus? What are all the cells? What are all the disorders? What are all the functions? So all this will help you to revise just before your exams, because it's difficult to go through all the pages. So if you have a summary like this for every topic, it will add more colors to your workbook. Getting the right partners for reading. This is a very, very important part of reading, because group discussions will definitely enhance your preparation. You have 19 subjects to read, and the thing is, some students really like physiology, medicine, more of physiology based subjects. There are some students who like anatomy, surgery, OG, more anatomy based subjects. So if you have a group of friends, one student will be more fond of clinical medicine based subjects, so you can study medicine related subjects and you can share your subject with the others. And if you're a person who likes anatomy, you read anatomy and share your knowledge of anatomy with others. See, if you keep teaching others, no, so it is equivalent to revising 3 times. One time you teach your friend, it is really equivalent to reading or revising 3 times. So if you make a group, if you're able to have a group of friends, each of you who's good in a particular subject, read that subject thoroughly and just try to share your knowledge with the others. So that is going to be of big help. One more thing you should remember here, if you get wrong partners for reading, that is going to be more disastrous. So you should be really, really careful when you choose partners for reading. How to integrate the subject. So the next pattern of exams, they are more focused on clinical based questions to give you a clinical touch. Yes, of course, that is more important, but you should understand something. Without learning basic subjects, anatomy and physiology especially, you can never go into the reading of clinical based subjects like medicine, pathology, pharmacology. Only when you know the physiology of an organ, let's say the heart, only when you know the physiology of the heart, you will be able to correlate, integrate it with medicine, cardiovascular medicine, or cardiovascular pathology, or drugs related to CVS and pharmacology. So please don't think that it's going to be a clinical exam. Next pattern is clinical pattern. So there is no role for basic subjects. It is definitely not like that. Only if you have a clear knowledge of the basic subjects, you will be able to integrate it on the clinical side. For example, let's say in medicine, there's a pure clinical question on ECG. They have given you an ECG and there's a clinical scenario. Only if you know how to read an ECG, which is taught in physiology, only if you know what are the normal waves, which is also taught in physiology, you will be able to correlate the abnormality in medicine. Let's take pharmacology. You're learning about any drug used in the treatment of diabetes mellitus, or you're learning about insulin. Only when you know what is diabetes mellitus in physiology, what is insulin doing to glucose, what is the role of glucose, what is the pathways of glucose in biochemistry. Only when you know all this from the basic subjects, you will be able to answer that question in pharmacology. So please understand that if you want to make your preparations more easy when you face the clinical pattern, definitely you need a thorough knowledge of the basic subjects. So please don't go and directly read the higher subjects, clinical subjects like medicine, OG or surgery without learning anatomy and physiology. If you go about reading clinical subjects directly, it will definitely increase your workload. So please do the basic subjects first, gain a thorough knowledge of the basic subjects, then you automatically, you yourself will be able to integrate it with the clinical subjects. Yes, so I think this discussion would have helped you to have an idea of how you're going to start your preparations for the next exams. So always remember this: work hard in silence and your success will make the noise. So my best wishes and good luck to all of you. Thank you so much. This is Dr. Abhirami signing off. Thank you.